Hello, students. We will continue with this topic of occupational health, and in this lecture, we will study some other common occupational lung diseases. So, in the last lecture, we studied the silicosis, and now this is asbestosis. It is caused by inhalation of asbestos fibers. These are silicates of magnesium, iron, calcium, and sodium, and occurs in fine fiber forms. Asbestos is a generic term for a group of naturally occurring fibrous mineral silicates. They are crystalline in form and are capable of splitting longitudinally into single fibril or fiber bundles. Asbestos is used in making cement products such as pipes and roofing sheets, other roofing materials, papers, electric insulators, floor tiles, paints and coatings, plastics, brake linings, etc. The risk factors include workers engaged in mining, milling, processing of asbestos, transport of mined or milled asbestos, manufacture of asbestos products, and disposal of waste material from asbestos mining, milling, etc. They are exposed to the risk of inhaling asbestos dust. Now, what's the mechanism of action? The inhaled airborne fibers of asbestos of less than 3 mm diameter, they penetrate the airway and retained in the lungs. After long heavy exposure of 5 to 10 years, there is substantial retention of asbestos fibers. This gradually leads to progressive, diffuse interstitial pulmonary fibrosis. After a latent period, rarely less than 20 years and up to 40 years or more after first occupational exposure, lung cancer, malignant mesothelioma of the pleura, or gastrointestinal cancer may develop. Exposure may be assessed by sampling static air at fixed locations by membrane filters, impingers, and thermal precipitators. Biological assessment include radiography by using the International Labour Organization International Classification of Radiograph of Pneumoconiasis. Sputum test. Asbestos bodies in the sputum may be counted to give a rough estimate of relatively recent asbestos exposure. Now, the next occupational lung disease is anthracosilicosis. It's called, it's also called coal worker pneumoconiasis. It's caused by exposure to mixed dust in which the free silica is not the dominant fibrogenic component. Risk factors are mixed dust formed during coal mining is most liable to accumulate in deep mines, especially where mechanical cutting is involved and ventilation is ineffective or poor. All workers in deep mines, workers in loading operation of those industries using coal are at greatest risk of exposure. The presenting features are there is no signs or symptoms in early stages. Clinical disease is preceded by many years of X-ray signs of simple pneumoconiosis. Complicated pneumoconiosis develop only when the dust burden is very high. If dust exposure is stopped at an early stage of simple pneumoconiosis, little disabling disease occurs, unless the miners develop rheumatoid disease with synergistic lung changes, that's known as Kaplan syndrome. And anthracosilicosis, serious disability occurs after exposure to much higher dust level than than in the case in silicosis. Furthermore, disease is less likely to progress. So we can say that this silicosis is more dangerous as compared to anthracosilicosis because the disability is less serious and disease progression is less. There is no specific treatment, and the control measures recommended for silicosis are also applicable for anthracosilicosis. Now, the Bagasosis. It's allergic condition due to inhalation of dust from the fibers left after the sugar has been extracted from the cane. These fibers are known as baggies and are used for the manufacture of fiber board and similar boards. Moist and hot condition led to growth of molds or fungus on the baggies called thermoactinomyces vulgaris. Exposure of 2 to 4 years is usually enough to produce symptoms like breathlessness and low-grade fever. The preventive measures consist of suppression of dust, use of personal protection measures apart from periodical health examination, and engineering method of control. Now the farmer's lung. Farmer's lung has a seasonal distribution related to harvesting of crops. Since India is agriculture economy, most farmers are exposed to the risk of hay dust or grain dust. On moldy hay, the fungus growth of Micropolyspora fini and Thermoactinomyces vulgaris act as an antigen for allergic pneumonitis due to hypersensitive reactions that lead to this condition known as farmer's lung. This was all about in today's lecture. We will continue the same topic, that's occupational health, in our coming classes. Have a nice time.